Hey everybody, it's Christine Garvin and welcome to Hormonally Speaking. So glad that you're here with us today. I'm really excited to talk to our guest today because she's going to talk to us about something that I feel like has just kind of risen to the surface recently in terms of people talking about this particular condition. And there's still sort of a lot of unknowns maybe or misunderstandings around it. And so I'm really excited to talk to our guest. And the subject is actually PMDD. She's going to tell us all about that. First, I'm going to introduce her. Her name is Rebecca Sairs, and she's a registered yoga teacher and certified health coach who specializes in helping women ditch their PMDD symptoms naturally. Sweet, we're excited to learn that. She does this by empowering women to make lasting food and lifestyle changes so that they can feel happy and like themselves all month long. Rebecca believes that a woman should be the PMDD boss of her well-being, and she strives to help her clients keep their power when making decisions around their health, and that is so important, as we all know. Rebecca is certified through the Integrative Women's Health Institute. She studied under Nicole Jardim in her Fix Your Period Apprenticeship and is currently working on her national board certification in health and wellness coaching. Wow, busy woman. Welcome, Rebecca. So glad you're here.
Thank you. I'm excited to be here.
Yeah. So let's just start off with, this PMDD, which, as I mentioned, some people have maybe heard a little bit about, maybe some people haven't heard about it at all. And, let us know the difference between that and PMS. Like what's going on here?
Yeah. So PMDD stands for premenstrual dysphoric disorder, and it is a mood-based disorder. You can find it in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. So it is a real thing.
I didn't know that. I did not know it was in there.
Yeah. So, and it's similar to PMS. I think most of us are familiar with PMS. Like, we get a little moody, we get irritable, we get like maybe breast tenderness or bloating in the day to week before our period. PMDD is similar in that you experience mood and physical symptoms, but they are so severe that they disrupt your life. So some women are so tired or depressed that they can't get out of bed and go to work, or they go to work and they are getting into fights with their coworkers and they get fired, or they just have so much rage towards their family or their friends that it disrupts their relationships, their school, their job, and makes it really hard to function. Right. And if you talk to a woman with PMDD, she's going to say, like, I feel like my brain has been hijacked. So they feel like this like switch has been turned on and they become almost a different person in anywhere from 5 to 14 days before their period. So for some women, as soon as they ovulate, it's like, bam, these symptoms appear.
Right.
And so the difference is like the intensity.
Yeah.
And then there's another condition, which also isn't talked about a whole ton. It's called PME, which is premenstrual exacerbation. And this is where if you have like anxiety or depression all month long, but then in the weeks before your period, your symptoms get even worse, that would be considered PME. So there's really like 3 things that we could be looking at.
And I haven't even heard of PME. Like, is that sort of a newer diagnosis?
I think so. I'd only heard about it maybe like a year or so ago. So, yeah.
Yeah, and it's, it's so fascinating because I think, well, first of all, women turn this stuff in on themselves, right? When they're experiencing this, and often are not helped necessarily in the medical industry and the sort of traditional medical, allopathic approach around this stuff. And so they don't really know what to do, in these situations. And I definitely want to hear about what, kinds of things that they can do. But just quick question that came up to me as you were talking, like, is this really kind of a progesterone issue in a big way since it's during your luteal?
That's a great question, because there's like, not controversy, but originally people thought it was your hormones were out of balance. Either your estrogen's too high or your progesterone's too low, or the ratio of them is off.
Mm-hmm.
But what they're finding is that it's not that you don't have enough of progesterone necessarily. You could still have low progesterone, but you can have normal amounts of progesterone, and then normally that hormone makes you feel calm and kind of relaxed and chill. But for some reason, women with PMDD, it doesn't have that effect on them. So instead, they feel anxious and they feel moody and they get these other symptoms that come along with PMDD. So it's not necessarily that you have too low of progesterone. But that doesn't mean that you also couldn't. Does that make sense? Like, you could still have too low.
Yeah.
Yeah. So it's definitely something to look into and get checked.
So then what are some of the, like, if a woman, you know, has enough progesterone and her estrogen levels are okay, you know, it's not an estrogen dominant situation, what are some of the things for her to look for on a concrete level like that?
As far as like what to do, or like as far as symptoms? Maybe
like what's kind of, I guess, an underlying or root cause issue with it?
Yeah. So, yeah. The sad news is they don't know totally for sure, even though it's almost 2020.
Of course.
Because, you know, like they used to, I don't know, like think that women were making this stuff up. And it's like, no, we're not. And we're not crazy. Like, something really is going on. Yeah. But the good news is they do have some ideas. So one is that it could be a hereditable condition. So if someone in your family has it, then you could be more likely to have it. There could be some differences or variations in there's this estrogen receptor gene that you have. Mm-hmm. So they've compared that gene to women without PMDD, and it's different. So there could be something going on there. And then, like I said, what you'll hear a lot if you start researching PMDD is that it's an abnormal response to normal hormone levels. And that goes back to what we were talking about. Like, you could have normal progesterone levels, but when that's interacting with GABA cells in your brain, usually that's where you get the calm feelings. But again, women with PMDD don't. It could also be an inflammation thing. Needs to be more research done, but there are signs that women with PMDD have more inflammation markers than women without PMDD. So looking into that. If you go to your conventional doctor, they probably won't bring this up, but looking into histamine.
Oh, yeah.
And I'm not a histamine expert by any means, so I can't get into the nitty-gritties of this, but so histamines can be pro-inflammatory, and a lot of times if we hear histamine, we're thinking like allergies or nasal congestions, hives, which are true, but it can also lead to anxiety, headaches, period pain. So if you're getting any of those symptoms with your PMDD, I would recommend like researching that. I know Dr. Laura Bryden has an article on her website about PMDD and histamine, so if you Google that, you can like go into all the nitty-gritty about it, but I would definitely say looking there is a good place. It's something else to look into, which if you start Googling PMDD, that might not come up first, but I think it is something to consider.
Right.
So, yeah, so there's a lot of things that could contribute.
Gotcha. And, you know, I mean, that all makes sense to me because I, you know, really focus with my clients on gut health as an underlying component of your hormone health, right? And that in order to really, truly, you know, work on your hormones and work on some semblance of hormonal balance, you have to see what's going on in the gut, you know, and that makes perfect sense to me about the histamine issue and the inflammation issue because, you know, if we have leaky gut, if we have sort of any kind of pathogens too that are hanging around in our gut that, you know, allow for food particles to get through our gut lining and into our bloodstream, which creates an inflammatory effect. You know, our body sees those as pathogens, whether they are or not, you know, and we're eating those foods all the time and causing this sort of inflammatory response. That impacts, you know, the estrogen receptors. That impacts the sort of, it creates this inflammation all over the body. And so yeah, that makes perfect sense to me that, some of, when it comes down to it, a lot of this stuff has kind of those same underlying components, right?
Yeah.
And it's kind of just like figuring out which one you kind of need to start with, or what healing options you need to do. So what are some of the major symptoms that women should look out for if they haven't been diagnosed yet and they think they might have it?
Yeah, so if you're trying to get a diagnosis, or if you, like you said, if you think you might have it, I would recommend downloading a PMDD symptom tracker, and you can just Google that and find that. I am going to have one on my website, so you can check out my website. But basically, there's two categories that you're going to track, and the first one is mood symptoms, and those are sadness, anger, depression, and anxiety. So you track every day how you're feeling. And then there's the second group is cognitive behavioral symptoms. And these are like you're not interested in your normal activities, you have a hard time concentrating, lack of energy, maybe insomnia or hypersomnia where you're sleeping too much, feeling out of control, overwhelmed, and then the physical symptoms like the breast pain, the joint pain, bloating. So in order to get a diagnosis, in theory, and your doctor might not require this of you, but I would recommend you do it anyway, is track your symptoms for 2 months and then bring that data with you to the doctor. And they're going to look and see, okay, does she have at least one mood symptom? So the sadness, anger, depression, or anxiety. And then does she have at least 5 symptoms total? So between the mood and the cognitive behavioral. And then she's going to look, okay, does it interfere with her life, her school, her work, her relationships? Because that's how they're going to distinguish, is it PMS or PMDD?
Gotcha.
And then hopefully your doctor will look into some of the common misdiagnoses are hypothyroidism can mimic it, because you also have the mood symptoms if you're hypothyroid. Mm-hmm. Bipolar is often something women with PMDD are misdiagnosed with, because in bipolar too, you have like days where you feel good and you're happy, and then you have days where you're sad and low and depressed. In women with PMDD, the same thing. You have those good days and then you have bad days, but it's related to your cycle. Mm-hmm. So they're going to want to look into those things. So those are the main things. However, some women with PMDD, I didn't talk about this, but suicide and suicide ideation is common too. Well, at least I think the statistic is like 30% of women with PMDD will consider suicide. So like, it's a serious thing.
And it doesn't surprise me at all that one of the main misdiagnoses is bipolar, right? And I'm curious, especially, over time, how many women have had these, labels put on them.
Yeah.
It really comes down to their cycle,
Yeah.
and they're put on these kind of really intense drugs.
Yes.
That, as we know, may or may not be helpful.
Right. Yeah. And I think that's super common. And like you said, like PMDD is starting to become more aware in people and doctors' minds. So before, you're exactly right. They would get misdiagnosed as bipolar and put on these drugs that weren't actually helpful for them. So
do you find that there's a good amount of doctors, I guess both OBGYNs and regular doctors that are aware of PMDD, that in a big way? I'm just curious if it's
I think if you go to your general doctor, I mean, they're expected to know everything about everything. So I think it's more likely that they might not know as much. But again, every doctor is different. I think if you go to an OBGYN, she's probably more likely to know about it. However, I always recommend that people kind of do their research before and find a doctor who is knowledgeable about menstrual mood disorders. And a psychiatrist too can diagnose you, just because it's like in that.
Right, it's in the DSM, yeah.
Yeah, so And I know, like, if you don't live in a big city, it might be harder to find someone who is kind of specialized in this. But yeah, I think awareness is growing, but I think it still has a long way to go because women can still feel like dismissed or not heard. Or
Yeah.
so.
Well, I definitely always encourage with my clients, you know, if you don't feel listened to or heard by your
Yes.
OBGYN, to definitely get second and third opinions if that's at all possible to do.
Yes.
Because you really want to have a relationship with your OBGYN that
Yes.
you feel supported and that, you know, you feel like they really take your, you know, real health into consideration, not just what they think is right.
Right.
And they're out there. You know, I've definitely had several clients after my prompting to just, you know, be open to other OBGYNs because their OBGYN wasn't doing a great job of listening to them, and they really found a great one after that, you know, and ones that I can work with too, and that's always a really helpful thing, right? When you're practitioners work together.
Yes, I agree. I always tell clients, like, your doctor is trained, she is smart, but she's your advisor. At the end of the day, you get to decide what you want as far as the treatment plan. You get to decide what feels good to you. And yeah, if your advisor, if she's dismissing you or you don't feel heard, definitely find someone that you want on your team, because that's what she is. She's like part of your team. She's there to help you. Find someone that can really help you.
Yeah, absolutely. So what are the kind of the approaches, the allopathic approaches with BD?
Yeah, so that's the thing too, like different doctors carry different toolboxes. So if you go to your conventionally trained doctor, she is going to use medications and surgeries. And so usually she will put you on an SSRI. The common one, well, I guess it could be different, but Prozac, the Seraphim is one that's common. If you are also looking for contraception, she'll also might consider instead putting you on birth control or maybe possibly putting you on both. So those are usually the first steps. So research will say that 60 to 70% of women with PMDD find relief from their symptoms on an SSRI, and 15% will get side effects. So that still leaves a big chunk of women where it doesn't really help. And then the side effects sometimes include some of the same symptoms that we're dealing with, like anxiety and migraines. And if you're on it when you're young, it can even, one side effect is like suicide ideation. So those are just things to be aware of. And then same with hormonal birth control. Like we have studies now that it can contribute to mood symptoms. So there's that.
Yeah. What kind of surgical approaches do they take with it?
They will do a hysterectomy.
Oh, right. Of course.
Yeah.
I don't know why, because I was thinking like with endometriosis, they'll go in and, you know, remove tissue.
Yeah.
And stuff. But yeah, of course, with anything else, it's pretty much hysterectomy.
Yeah. Yeah. So sometimes they'll try like a chemical menopause first, or for some women, they will do like a progesterone treatment. But again, for some women, it doesn't work, going back to the whole, like the abnormal response to progesterone. So adding in more doesn't necessarily work for some women, but for some it does. So really like
doing progestins.
Yes. Thank you.
Right, rather than the bioidentical progesterone.
Yes.
Too. So
yeah.
That has different effects.
Yes.
It's so fascinating to me because, you know, the things that you're telling me is essentially what I got offered when I found out I had a fibroid. So they they didn't offer me SSRI, but in terms of, you know, an estrogen blocker, which essentially puts you into early menopause. And then, you know, if that didn't work, a surgery kind of a thing. And so they kind of essentially take the same approach for all these things, right? Birth control is another option that they, you know, gave to me. And it kind of just shows you, I mean, I get it. That's their perspective and, you know, the work that they've done and their path, but it's so incredible because these are different issues, right? And so there's not a one size fits all approach.
Right.
Yeah.
Right.
Yeah. So what are some of the things a health coach does?
Yeah. So my perspective is pretty much going back to the basics. I call them the PMDD basics. And I was listening to a podcast with Dr. Jolene Brighton, and she calls it mama medicine, where everything your mama told you to do, right? Like, don't eat all that sugar, eat your vegetables, go outside and play, hang out with the right crowd, turn off the TV. Like, going back, yeah, they're really just like the basic things. And honestly, like, they're not sexy and they're not super exciting. But it's like going back and making these habits. So the first one is really focusing on food. So what you eat for your physical health matters, we know, but even for your mental health, what you eat can have huge effects. So we always start by eating real whole foods. So food that isn't in a box or a package, isn't highly processed. We focus a lot on balancing your blood sugar, because if you're having these big spikes and these big crashes, that can also influence your mood, like a ton.
Yeah, so much.
Yes. And then eliminating inflammatory foods, and kind of going back to what you're saying, like focusing on the gut and getting all of that like working at optimal levels. Because if you're eating lots of sugar or dairy and gluten that's causing this inflammation, like I said, inflammation might be one of the reasons for PMDD. So like, as much as we can, reducing that. So that's first, food. Second is sleep, making sure that you're getting 7 to 9 hours of really good sleep, putting yourself on a sleep schedule. Like, and I think too, if we think of like, if we have this little toddler walking around, what happens to her if she doesn't get enough sleep? The next day she's grouchy, she's crying, you know, she's mad. And these are all things that happen with PMDD, right? We don't get enough sleep, we wake up, we're
babies running around.
Right, like we're the same way. We still have to like care for ourselves. So working on that, movement, especially aerobic exercise, can help a lot with mood issues. And there's like tons of science. Oops, sorry, that's my cat. Tons of
time, so.
Yeah, so there's lots of research that shows like aerobic activity is really helpful. So making sure we're moving our bodies every day, and finding, I think too, sometimes we can feel like, oh, I have to do CrossFit or I have to go to yoga for an hour and a half or whatever. And it's like, you know, maybe you just dance in your kitchen to Taylor Swift for a couple songs, or you do a 5-minute yoga video on YouTube, or, you know, like just getting moving every day. And then stress is a big thing with PMDD, and really looking into ways that you can get rid of your stress. So if there's anything you can say no to it. And then unfortunately, we can't say no to everything. So finding ways to kind of change our perception about stress. And, you know, maybe that's yoga, maybe that's prayer, maybe it's mindfulness, or whatever that looks like for you. Like, but really focusing on how to kind of calm your nervous system and working on that stress. And then the last is support. I think probably with any health condition, you definitely need support, but with PMDD, you often feel like a crazy person.
Right.
And you feel really alone, and like your family doesn't get it, and they just think you're this horrible person. So reaching out there's lots of support groups on Facebook, or if there's one in your community, and also therapy. I always have my clients like, you have to work with a therapist. I am not a therapist, but CBT is a good therapy for PMDD. They've done research on it. And then also there is some connection possibly with trauma and PMDD. So if you've experienced trauma, then like finding a trauma therapist. And again, when picking out your provider, like, does she know about premenstrual mood disorders? Because you'll get farther if you find someone who's aware.
Yeah.
So,
I mean, that's all, you know, as we know, that's all stuff. And I talk about this pretty much with every guest, because this is the stuff that is just your basics, right?
Yeah.
That we need for our health. And we have had to push to the side in a lot of ways because of the crazy lives that we lead. But, you know, there is no one pill
Right.
or even one food that's gonna, you know, change everything. And, you know, I just want to tell a story about myself because this just happened yesterday and it really relates. Even though I don't have PMDD, you know, I was just kind of like in this sort of lull kind of phase, you know, and had been for a couple of days. There was definitely some anxiety creeping in. And all of a sudden I realized, wow, I haven't eaten much protein the past couple of days, you know. And I mean, we can debate forever. Everybody's got their ideas about, you know, what the perfect diet is. But I do know for myself that protein is very important, and like a good chunk of protein, you know, a lot. I mean, I eat a lot of vegetables and everything that goes along with it, but I need a solid, good chunk of protein to really, you know, keep me balanced.
Yeah.
And it was like, as soon, like, it like clicked in my mind. I was like, I went to a health food store here and I got some tuna salad, and literally within 15 minutes, I felt better.
Yeah.
And, you know, I think sometimes we forget about that kind of stuff, how important that is. And especially this time of year, you know, during holidays and everything, like, we can get off on just all the stuff we don't necessarily maybe normally eat, and how that impacts our mood so much. And so really, if you have PMDD, it's like just impacting it on kind of this whole other level, right?
Yeah.
Yeah. Whew, you know, and it's so, like you said, it's not sexy, right? Like, it's not like this fun thing that we can wrap up in a package and tell our clients, you know?
Right. Like, woohoo, balance my blood sugar.
Exactly. They're like, oh, that's exciting. But literally every client I work with, there's pretty much kind of some blood sugar issue happening.
Yeah.
Right?
Yeah.
Wow. So how long does it take usually when you start working with clients for them to start to see some shifts in their PMDD?
It depends on the client, honestly, and kind of what they've done before. So for some, they might see it within a few months. For some, it might be a little longer. I don't know if there's like one way for everybody. It kind of really just depends. And it depends on like how fast they're willing and ready to make changes. Because making these changes, like, it's all the stuff we know we should be doing, right? Like, we know we should be eating more vegetables and less Doritos, but like actually doing it is sometimes hard. And like, don't beat yourself up if you're struggling with it. Like, that's normal.
Yeah.
So.
And I'm glad you brought that up, because I think, you know, sometimes, I mean, clients want these huge changes to happen pretty quickly. And the reality of human nature is we need time to integrate. Especially when you have trauma involved, you know, and food in particular can be a very, you know, we're emotionally connected to it from childhood, you know, sometimes related to the traumas. And so shifting all of that can take some time and stuff you have to work through around it, you know, and giving ourselves the space around it and letting our bodies do what they need to do on their own time too. And I know that's hard for people to swallow sometimes, because they just want to feel better, and I get it, you know.
Right. Yeah,
and
I totally get it
too. That like they do tend to feel better, you know, at least a bit better pretty quickly. But then the bigger, sort of more you know, long-term changes, it just takes a while.
And I think too, like, I help clients with the basics, what I call the basics. And then sometimes it's like, once you build up that physical resilience, then it's like, there's probably something deeper that you need to address. You know, like, maybe you're in a job that is killing your soul, or like your relationship just isn't right. Like, and you need to get some therapy around that. You know, like, there could be like deeper things, but sometimes it's easier to work on, okay, let me really dial in my food. Let me really make sure I'm getting my sleep, you know, those things first. And then once you've kind of built up to a certain level, you can even dig deeper to what might be contributing. So, and I think that's a thing too. People want it to be one thing, and they'll be like, well, I changed my diet and it didn't work. And I'm like, yeah, well, your diet is like one piece of the puzzle. So keep going. There's
Yep.
other things.
Yep.
So
Exactly. Yeah. We have to be there to remind them of that, and we have to remind ourselves that sometimes.
yeah, for sure. For sure.
So one other quick question to kind of go back a little bit. If a woman, like, do women essentially kind of have PMS first a lot of times, and then it becomes PMDD, or is it something that, from a kind of young age, maybe that they have PMDD right off the bat?
Yeah, so I've heard of variety. I know some people where it did start like right after they started menstruating, like in their early teens. And then some women will be like, well, it started after I had my first kid.
Mm-hmm.
For some women in their 20s or 30s. I think the average age is 26 for the onset.
Okay.
So I think it really can vary.
Yeah. I wonder what it is about that age, or that time of life or something.
Yeah. Or if it's
Because-
just like
yeah.
everything snowballed and it kind of comes to a head at that point. I don't know.
That kind of is just thinking back to like 26 to 28 is a time in life of sort of really stepping into adulthood, I think, in a different way, and maybe some of the stress of all of that coming together might be part of it.
I've never thought of that. That's super interesting. Maybe.
Yeah.
Yeah.
It's so fascinating now that we're having these conversations much more about, women's health, and all of this stuff comes to light that we didn't really know about. I mean, I know I didn't talk about it in my 20s in any kind of big way, and I was getting my master's in holistic health education, and we weren't talking about our mental health. I know, right? It took me getting a fibroid and going through, a crazy situation to really learn about all this. And so I'm so thankful to people like you that are out there talking about this stuff and helping women with it. So, so tell people where they can get in touch with you.
Yeah, so I'm most active on Instagram, and my handle is at Rebecca5Joy, Rebecca with 2 C's and the number 5. You can also check out my website, RebeccaJoyWellness.com. And like I mentioned, there's a period tracker, a quick start PMDD guide if you feel like you might have it, or you have it and you just need some resources. So check that out.
That's so great. Thank you for offering those resources for women, because I know some people listening to this will be like, oh, let me go check that out. So, and we'll have all of the, your website and the links to your Instagram in the show notes. So
thank you.
If you go there and click on that. So, Rebecca, thank you so much for being with us today. It was so good because I know about PMDD, but I definitely learned some interesting aspects about it today that I'm happy to know about to, point women in getting, if they need to get diagnosed, they haven't been diagnosed. Understanding around that. So
awesome. Love it. Well, thank you. I appreciate the opportunity to share.
For sure. All right, you guys, check out Rebecca's website, and you can always leave us a review is very, very helpful, and we very much appreciate it on iTunes. And I will see you next time. Bye for now.